The whole world already knows I have Botox. We don't need to do it.
Okay, now we're going to test your shoulder and your shoulders, your arms, your upper extremity. And
Okay.
First I'm going to notice, and I would have you draped like this, and I'm going to notice any obvious atrophy of the upper extremity, including, flip your hands over into the thenar eminences and into the hands. And then I'm just going to move your arm, okay? So stay nice and relaxed, okay? Just let me do the movements. And I'm going to flex the fingers, flex the wrist, flex your elbow, flex your shoulder. I'm just going to notice for any obvious flaccidity, spasticity in that. I'm going to do the same thing over here, just kind of relax. Let me do the work. Perfect. In all of the areas that I just stated, okay? Now we're going to go through strength, and I think we start with shrugging.
Shoulder flexion, extension, abduction, and shrug.
Okay, good. Okay, so let's just do shrug up here. Good. And now, shoulder flexion and extension. Can you hold your arms out? Don't let me push you down. Flexion. Good. And I can do that bilaterally and relax your arms. And I'm going to ask you to, like you were giving my hand an elbow here, okay? Push against my hand, extension. And like you're giving me an elbow here. Against my hand, extension of the shoulder. Abduction, put your arms out to the side like they were kind of flopping, flapping. Good.
Okay.
And then we're going to do,
Arms, biceps, and triceps.
so I'm going to ask you to hold your arms like this. Don't let me pull you down. Don't let me pull you down. Good, that's the biceps. The triceps, you're going to push your arm and try to straighten it out. Good. Same here. Push and straighten it out. Good. And then we should be down to the wrist.
Wrist hand, extension, flexion, extension of the finger, flexion of the finger, and abduction and grip.
So extend your hand like this up, and don't let me pull you down. Good. On either side, don't let me pull you down. And extension of the finger, correct?
Wrist extension and flexion.
Sorry. And wrist flexion, go ahead and pull up against me. Good. And there's a lot of ways to do this.
And then finger extension and
Okay.
flexion.
Go ahead and hold your fingers up like you were waving. Don't let me push you down. Same thing. Don't let me push you down. Good. Hold your fingers like this. Don't let me uncurl them. That's flexion. Good.
And then abduction.
Spread your fingers apart like this, and don't let me squeeze your fingers together. Same thing. Hold them apart. And make sure I get your thumbs. Don't let me pull them in. Good.
Okay.
And we did
Grip
grip
strength.
strength. Okay. I'll cross. You just there you go. And squeeze as tight as you can. Okay.
All right, now we're doing hips, flexion, adduction, and abduction.
All right. On the hip, we're going to actually, I'm going to ask you if you would just to lie back.
Sure.
I would have my patient, obviously draped so that I could see this area and inspect the whole lower extremity and looking for any obvious atrophy. Then I'm going to passively take her and I'm going to flex her foot, ankle, hip, and just relax. And I'm going to just flex that foot and ankle, flex her knee, flex her hip, and then straighten it out. And again, looking for any obvious spasticity or flaccidity. And again, good. And now, if you want, you can go ahead and sit up.
Okay.
We're going to test some strength here now. And I think this one you're going to do hip flexion and push
Okay.
up like you're going to knee me in the nose. Good. And up. Good. And now you're going to try to push against my hands into abduction. Good. And now you're going to squeeze your knees together, adduction. And now I think we have to do extension
Not of the hips.
of the knee.
Of the knee.
Yeah. And go ahead and push out against me, trying to extend your knee. Good. And
Foot and
now,
ankle dorsiflexion, and then great toe extension.
didn't we have to do knee flexion also?
It says knee extension.
Okay. And then dorsiflexion, we're going to go ahead and hold your foot up. Don't let me push you down. Good. Resisted dorsiflexion. Good.
Great toe extension.
And then hold your big toe up in the air. Don't let me push it down. Good. Same on this side.
Foot eversion.
Okay. We're going to turn the sole of the foot outward, and I'm going to turn it outward, and don't let me push you in, okay? Good. Perfect. Sole of the foot outward. Don't let me push you in. Good.
And plantar flexion.
And you're going to push hard like you're pushing on a gas pedal. Push hard. Good.
And now we do cerebellar function and proprioception.
All right. So our first one on
Rapid
cerebellar
alternating movements.
is you're going to go ahead and do what I do. get your hands back and forth on your thighs, real fast now. Looking for the symmetry. Good. And now you're gonna tap your toes as fast as you can on my hand. Tap, 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 tap as fast as you can. Good. And again, looking for the symmetry and how rapid the movement is.
Point-to-point testing, finger to nose, heel to shin, finger to finger.
Okay, I wash my hands after touching your feet, and I'm gonna ask you to touch your nose with your finger, and now touch my finger. Good. Touch your nose. Good. Touch your nose. Good. Touch your nose. Touch my finger. Close your eyes and see if you can touch my finger. I held it in the same spot. You can open if you need to. Good. Now, open your eye. Now touch my finger. Touch your nose. Touch my finger. Close your eyes. Touch my finger again. It's in the same spot. All right. Good job. And then I'm going to ask you to put your arms out like this, finger to finger, and just watch me. I'm going to close my eyes and try to touch my fingers together. And could you do the same? Close your eyes, fingers together. Good. And then finger, finger. And then yes, you're going to bring that leg up and you're going to take your shin and right down, your heel right down the front of your shin. Very smooth and coordinated. Very good.
Okay, now we're doing equilibrium. Gait, heel to toe walking, stand on one foot, Romberg and pronator grip.
So I'm going to walk with you for a minute, and I would like you to just do heel to toe walking. So you're going to walk one foot right in front of the other. You kind of keep your head up. Good. Noting the balance. Okay, you can turn around. Good. And we're going to do
Turn on one foot.
Yeah, balance. Good. And on the other foot, why not? Good. And now I'm going to have you just stand with your feet, your arms at your sides. I'm going to spot you here, but I want you to keep your eyes closed. I just want you to just stand there and balance and noting any swaying in the Romberg or moving the feet. I do that for 30 seconds. Okay, stop. And now I'm going to have you put your arms up like this. And I want you to hold your arms there and close your eyes. And we're going to see if either of these arms drop down in this motion, and just try to hold them there. If she's holding them real well, I'm just going to give her a little tap and see if she can maintain that. Okay? Good. And I think that was our cerebellar.
Now we're just going to do superficial and deep reflexes.
Yes. Okay. Our upper extremity deep reflexes are,
Deep tendon biceps, brachioradialis, and triceps.
okay, just relax. Biceps. And what is that? C?
5, C6 for brachioradialis, and C7 for triceps.
Brachioradialis. Perfect. Relax your arm. There we go. Good. And then on your triceps, I'm just going to try to get you just to relax here as best you can. That's it. And clench your teeth for me a little bit. There we go. Good. And same thing. Relax. Clench your teeth. Good. Good. And now on your patellar, can you roll those pants up? Perfect. On your patellar reflexes, just relax. If you want to go like this and pull your arms apart, or pull your arms like you're pulling them apart. Ooh,
I don't have very good
you sure
reflexes, I'm
don't.
sorry.
There we go, little one. And I'm going to just get this Achilles down here. Good. And then our abdominal. Oh,
Do plantar?
We do have to do plantar while I'm done.
Superficial plantar.
Sorry about that.
No problem.
Okay, just relax. And on the superficial plantar, I would come up. I'm not going to, you know what? I'm going to use this. I won't cut the bottom of your foot. And I'd expect a plantar response. Good. And then
you check for clonus.
I'm going to go ahead and just relax your foot. Dorsiflex very hard on both feet. And look for the clonus, the bump, bump, bump of the foot. Okay, and upper extremity, we're going to just relax and go into a full hyperextension and look for the clonus.
And then superficial abdominal.
All right, on the belly, we are going to go ahead and do the superficial abdominal reflex. I'm going to have you lie back. You're probably going to not want your belly. Well, maybe so. Okay, good for you. We want to make sure we have good exposure on this. Again, our abdominal reflexes, we want to do a quick stroke up and look for the umbilicus to go toward that area in the right lower quadrant, in the upper right, upper left, lower left, and say your corresponding nerves with those.
All right, and I think that's it, except now you just have to talk a little bit about special testing for meningitis and coma.
Exactly. Okay, so our meningitis test we're actually going to do.
Okay.
Could you lie back one more time?
I certainly can.
The Koenigs and the Brzezinskis, okay? This first one, I'm going to just relax your head, and I'm going to just take the patient and passively flex the neck, and I would expect from this the knees and hips to flex also. So we get actually, the response would be the flexion of the knees and the flexion of the hips to take the strain off of the meninges in the cervical area. And then that was our Brzezinskis. This is our Koenigs. We're going to take this leg up, and as we straighten her out, as if we were going to stretch her hamstrings, there is significant resistance again on this, and the patient will not let me do that because of the resistance in that area, sending it up the meninges. Okay? And then our last couple tests are, we're just going to talk
Just
about.
to talk about oculocephalic reflex
Yeah.
and oculovestibular reflex.
Now, actually, let's go back to the flaccid paralysis. And the flaccid paralysis would be the patient, it's just worth 1 point, so I'm not going to lay you back down. But what I would do is, if the patient was in a coma, I would, in fact, let's lay down.
Okay.
All right. Flaccid paralysis, I would just take the hand and just drop the hand and see if it goes down to 90 degrees, if it is indeed flaccid paralysis. I could also drop the hand and looking for that, just to drop in a very flaccid way. I can also do the same thing on the leg and do the leg drop and seeing if we have the same exact thing in the lower extremity for flaccid paralysis. Also, doll's eyes, or the oculovestibular reflex, I would take off her glasses. I would hold her eyes. Do you have contacts?
No.
Okay. I would hold her open, and then as I would rotate the head here, a normal with brainstem intact, the eyes would rotate the opposite way. And if I go this way, the eyes would come toward me. The pupils would come toward me, and that would be brainstem intact. If they were fixed, or if they were going every which direction, it would be brainstem not intact. And then we could also do the caloric reflex, caloric stimulation, oculovestibular. We can take very ice water, irrigate into the affected ear, and watch the eyes should come toward the irrigation and then jump back. And that would be brainstem intact. That was it. I think that's it. Okay, thank you.